Hi, everyone. Welcome to another episode of Dental Talk 360. I'm Dr. Alfredo Raus, and today we have the pleasure and honor of having Adrian Mesa, owner of AMP Mental Health. And we're excited to go into a journey of mental health and kind of let's go into your background. What got you into the field? What got you into helping others kind of help them in their mental issues?
Yeah, I experienced mental illness from a very young age. From the age of 6, I knew what a Baker Act was. If you guys don't know what a Baker Act it's an involuntary examination of a patient who's either a threat to themselves or a threat to somebody else. And that was my uncle. And so my uncle was somebody who I admired, I loved, I cared about. And he was somebody who taught me a lot of different aspects of life. My dad was always the working man, right? But my uncle was always present. Hey, let's throw a baseball. Let's learn how to swim, et cetera, et cetera. And long story short, the theme in the family was, oh, Leo is sick. And so whenever I would realize Leo is sick, he would just kind of regress into isolation. And then it just became this thing where I realized that it not only affected him as an individual, but it affected him, his family, my cousins, the family as a whole, and even the community, because he would lose his job, et cetera, et cetera. So I just saw that revolving door throughout my childhood, my adolescence, and even my adulthood. And so that was really what inspired me to get into mental health.
Interesting. And then from there, having that and visualizing as a child, obviously, that got you into your space now. How does it feel doing what you do and seeing you helping others in your career now, as opposed to, as a child having that visual with your uncle?
Yeah.
And now being able to actively say, I could help him at that time and I could help someone get better from that situation.
I basically went into the field treating everybody as if they were my family member. So I recognize the fact that people are often stigmatized, pushed aside, and that whole theme of Leo is sick was something that exists throughout the community. And we don't say, oh no, Leo is suffering from mental illness. Mm-hmm. Leo needs help. He needs psychiatric medications to stabilize. And if we just normalize it, the same way you guys normalize a cavity, then we can actually have an objective discussion about it, talk about what the treatment plan is, and then move forward to not only help that individual, but his life as a whole.
Yeah, and I find there's parallels in my career. So for example, a true story, I have a patient of mine that has PTSD. She was attacked by a dentist, and for her whole life, she didn't get treatment done because this dentist essentially raped her in the chair. And now I don't know that until later, right? I could see the apprehension in her. I could see that she has her mom in the room and her husband in the room, and I'm asking questions. And it really takes trust for somebody to break those walls. And it took me probably around 5 or 6 appointments to really break her, because I knew something was wrong. And then eventually it came out, and it was just like pouring, crying out. And, she had gotten put under IV sedation, and the dentist molested her while under IV sedation. And that caused a 25-year gap in treatment, which led to me having to do a full mouth rehabilitation on her, which was obviously very difficult for somebody that has no trust in a profession, let alone a dentist like me, right? Because they see that. How can us as providers really help, obviously by listening and understanding, so I know how to approach that situation? Obviously recommending treatment, for example, at AMP Mental Health. How can we as medical providers, let it be dentists, medical providers, doctors, physicians, how can we do better at understanding and managing patients that have trauma, so that we could treat them better?
Probably just pre-screening and identifying the fact that the trauma exists. Mm-hmm. And that way you can have that conversation during the initial assessment and saying, is there any apprehension in this procedure, in being under sedation? Do you need somebody to accompany you in the room, and letting them know that you're comfortable with that? Mm-hmm. Because I think as long as that takes place up front and there's open communication, then I think that just opens up the doors to trust, to rapport, and all of a sudden now there is that apprehension and anxiety is at least diminished.
We were talking about this a little bit before we started. and you were saying how like someone randomly will just reach out to you, and they seem to already have that trust in you. They go to your referral basis, all of that. What do you think is the reason that you're able to build that trust with someone that you've never met? Because most of our patients, if it's a new patient, like you said, you're starting from nothing, so you really have to break it down. But what would you say is a strategy that you've used or continue to use that builds that trust quickly?
It's doing what we're doing right now and having an open and real conversation and being vulnerable. Because I think most people, we want to live behind this facade of what we want to present to the world on Instagram, on our highlight reels, on our stories. And not too many people are actually saying, hey, like, I'm going through it. I'm struggling a little bit right now. Life isn't perfect. But I think that many of us, and understandably so, we don't want to tear away those layers because it hurts our business, or we're afraid that it could hurt us financially, hurt our the way that other people perceive us. But I think for me, I'm just like, listen, I'm a regular dude. I grew up in Hialeah. I don't even know how I am where I am today. When I used to stand in front of my students at the University of Miami, I was like, look, I'm a professor here, but I don't know how I got here. I mean, obviously I went to school, but I'm not supposed to be here. So I don't feel like I have anything to lose. I feel like I only have something to gain. And what I love to gain is somebody else's trust to help them. That's awesome. Don't ask me why. I feel like a sense of purpose. I've always felt like that way.
Yeah, like for me, I have other patients, like one example, she just lost her dad. And for me, it was instantly having the conversation of, hey, I lost my mom 2 years ago. I know what you're going through. Like, we could talk about this if you want to, because I feel like in our world, not only do they need to trust us to do the work well, but there has to be that relationship.
Yeah, you need to create a connection.
You need to create the connection. And for me,
in treatment period,
yeah,
to have like something successful, because a lot of the times, you know, we, as cosmetic dentists, like we're changing someone's life. Like we do this on a daily basis, even if we don't realize it as much. And one of the keys to a successful treatment is not just doing the incredible work and doing everything standard so that everything is amazing, but also being able to connect with that patient. Yep. Since you can do the most beautiful work in the world, but if that patient is not mentally there, they're always going to find something
100%
that they're not satisfied with. And you know, as dentists, by the way, dentists is supposed to be like one of the number one leading causes of, professions with suicide rate. And that has to do, I think, with the fact that that we take things so personal, in the sense that like we're thinking, oh, we messed up, oh, we didn't do this right, we should have done this differently. And behind everything, behind all curtains, it was actually the patient that is not mentally there. Even though they got this beautiful smile, they're not satisfied fully. And it has to do with something that it's them, it's not really you. It's their mental stage at that moment. They're thinking that they're getting this veneers and it's going to change their life, when in reality, there's something much deeper than
there's always something there.
Exactly.
Like, they could take it out on you or your assistant or your employees. But sometimes, for example, I'll have somebody that kind of lashes out at my employees or something. And then I'll walk into the room and be like, hey, what's going on? This isn't really how you are. And then it comes out. And it's just a matter of having that conversation. Then you get the breakdown. And then it's understanding that we are humans and we need to have communication, right? I feel like there has to be an incredible amount of empathy and an incredible amount of communication in order to, one, communicate with somebody properly and break down barriers. Am I correct? Do you find that people tend to, I always say this term, we have so many means of communicating with people, but we just don't communicate like we used to. You know, true communication, talking to you in person, talking to somebody on the phone, you know, reaching out.
Yeah, I think, that's the obvious in terms of we're texting, we're on social media, we're sending fire emojis as if that has meaning behind it, as opposed to just picking up the phone and saying, hey, I'm really proud of this accomplishment you just had. Yep. So you're replacing a 10 or 15 minute conversation with a fire emoji. It's kind of bizarre if you think about it. And that doesn't create any sort of back and forth or, hey, I actually struggled when I was building this thing. So when it comes down to people that are just kind of lashing out, I think a lot of it is lack of self-awareness, right? A lot of us don't have the awareness of what we're dealing with internally. We don't have that internal dialogue to say, what is causing me to struggle? What is causing me to feel this level of frustration and irritability? and holy shit, I'm taking it out on my loved one. Like, let me take that back a little bit and look inward instead of pointing outward. It's really easy to point your finger at everybody around the room, and it's your fault, it's your fault, it's your fault. Guys, if you're walking around and you're pointing the finger outward constantly, take a step back.
Yeah.
Journal, write things down, try to sort out what's going on in your mind to say, wait, what am I doing to cause some of this? Because I can't be the victim in this whole situation. Everybody, the world is not against me. There has to be energy I'm putting out that I'm getting back, and I'm trying to blame it on everybody around me. Yeah. So I think self-awareness is huge. And that's why I preach therapy to everybody, because I really believe it. Let me say this. Therapy generates, I know we're going to talk about business a little bit, right? Therapy generates the least amount of revenue for my practice. The margins are nil. Like sometimes most people would say it's not even worth it. But I preach it more than everything else because it's the most effective. For medication management, I probably get a 4x return. I don't get a 1x return on therapy. So I'm telling you that there's value in therapy, but nobody's using it, and insurance companies aren't reimbursing for it. So if you have access to it, use it.
Why do you think there's such a stigma?
Oh, here we go. There's a lot of questions.
Let's go. I want it. I want to load it. I want to ask, why is it? And I'll be one. I'm gonna be honest. I'm gonna break that barrier. I'll be one to say, hey, I definitely need therapy in my life.
Yeah.
But have I seeked it? Have I gone to someone like you and say, hey, let's talk about my personal stuff? No, because there's always, as a guy, there's a stigma. And I remember this from watching. I was a big fan of The Sopranos.
Okay.
And there was that whole situation with Tony and the therapist, right? But it really helped him break down a lot of things. Yeah. So what is that stigma? What is it that's not allowing somebody to go get the help they need?
I mean, in the Hispanic culture, I could say that it's like they call it going to a loquero, right? you're going to the crazy doctor. So I think there's just all these layers that have been placed in front of you. Men don't talk about their emotions. Men have, suck it up, walk it off. There's no pain. Boys don't cry, etc. And you find yourself in a room talking to a stranger, and tears start coming out. You're like, whoa, what's going on with me? Yeah. So there's just a lot of layers as to why we don't. But that's why I'm here to just break it and be like, guys, this is fucking stupid. Like, it's dumb. We have the resources in front of us. We have so much access. We can do therapy from your living room. Just try it.
And I think it should be part of like just your regular life. Like, for example, when my wife was pregnant, like I went through a little 3 months of hell. It's normal. And I reached out and I was like, hey, Adrian, like, I don't know, set me up with somebody because we need to have some like couples therapy because we're going through a struggle in the relationship. We both realized it, and talking amongst each other was not getting us anywhere at all. So we started doing therapy within a couple sessions with you guys, and it was great. Like, we were able to break some barriers, like try to communicate differently, and it was something that and I didn't feel, at first I was a little bit like, I don't know, man, because it's that stigma of like, oh, we're men, like suck it up, like you don't really need any of this. But sometimes, like, I think for your mental health, it's good to have some sort of therapy on a regular basis, because it's a moment of you to just kind of like sit down, talk, say everything that you have, and have somebody that just listens to you and then in a way helps you figure it out why you're acting a certain way, because you always act a certain way because of something, even if you don't realize it. So being in the right state of mind, for me professionally, allows me to be able to be better at what I do at work, to be able to connect better with patients, to be able to deliver my 100%, rather than just holding things back and you get to a certain point where you just literally explode. So,
well, I think that's interesting, like you just said, being in your best state of mind, everything else tends to fall into place after that. And we were saying, you said earlier, people jump to give them a Xanax, they'll shut up and it's fine. Yeah. But there's all these different modalities that you can do. You said you do grounding. Like, for me, it's like I need to eat healthy, I need to exercise. And when I do those things, everything else is good. Yeah. When you start to trail off of the healthy things that help your mindset and help your energy and your focus, everything falls apart. That's how it feels. And everything kind of crumbles in on you. So you said therapy is your worst return
in terms of monetarily, yeah.
But probably your best results for your patient.
100%. The question is, how do you get people to actually want to go?
Go through the process rather than
Because
fix me right now.
Because it's a grind.
Yeah.
Sitting in there and being vulnerable, whether it's individually, because they're going to touch things that you're like, I've never said this out loud before.
Yeah.
I've never spoken to anybody about this particular thought that has been circling in my head. And then you find yourself in that moment, do I actually work through this? Or do I just retreat and, no, we're good?
Yeah, it should be like any workout. Like we work out, all of us, to stay fit, to be physically attractive, feel great, have energy. Same thing should be with your mind. You have to work out your mind. Like there's times in life that you, like for example, for me, therapy was more about understanding myself. Like I wanted to know more about me. That's what intrigued me to do it. I was like, I gotta figure myself out because I'm the type of person that I need to control. Like that's just who I am. I need to control everything. So same way that I want to control like how the outcome of my cases come, how my work, how I'm with my wife. Like I want to be able to control my mind. Your mind sets everything. So if you're in a great mood, everything just starts going well. Like I go through stages where I just talk to Vince and I'm like freaking out because I haven't had like, I'm freaking out at work because my production is not where I'm at.
I'm his therapist.
This is my therapist. Like, I'm just like, and Vince is like, bro, relax. Like, it's going to be okay. Have a different mindset. And then when I started doing those things, and now I'm like, all right, you're right. Like when you change your mindset, you're going to realize how everything else starts to follow, So it's about like, it's a process. It's not like a one-day thing. Like it takes work, it takes dedication. Same thing that anything in life takes work and dedication and passion, and you just have to grind it and do it. Mental health is just the same thing. I think we should normalize that more.
You said it earlier. If you're pointing to everybody else and you don't recognize your energy in a situation, it's usually you. So if you're going into a consult or out in public or anybody, anywhere, and you're meeting people with negative energy and frustration or whatever
They're going to mirror you.
They're going to be like, dude, this person is like bad aura, like get away from me. Versus if you're positive, you're kind to people, you have good energy, you're doing the best you can, usually you'll receive that same thing back. And I think that's across everything, but especially for us where it's very, professional driven is kind of the focus of our lives, I would say. If you can't go into that with that positive energy, you're not going to get that same sort of return that you're looking for, satisfaction, financially, growth, all of that.
Of course. You guys have touched on like 50 topics in like 3 minutes. So I just want to chime in real quick. So you talked about exercise. I guess somebody mentioned almost like the pillars of mental health before therapy. It's going to be sunlight, nutrition, sleep, movement, and then a sense of community or social support. The part with community and social support, it sounds like both of you have that. You have rapport with one another. You're struggling, and so you go to him, right? How many?
My therapist.
No, it's good. How many guys do not have that?
A lot.
A lot. Plenty of people are going home. They're on social media. They're just scrolling and scrolling. They go on YouTube. They watch a TV show on Netflix, and then they go to bed. A lot of people who I was seeing when I was seeing patients, one of the questions I ask everybody is, if you're having a really shitty day, who do you go to? Most of the men would say nobody. Nobody. So it's just that sense of rapport, that community is something that we're lacking. And so I encourage people. That's why I love group fitness, because I establish so many relationships through there. And they're not just superficial. They end up becoming people who somehow become part of your life. You do business with them. You network. They look for support with you. You hold each other accountable. So group fitness is one. If you go to church, that's another great one. I don't care if you go to a book club, a bowling club, something, but a team. Yeah. You guys play pickleball or paddleball. Paddleball. Yeah. So those are the things that we need as not only as men or women. We need that sense of community. Yeah. Then there's, I could go on and on about movement and everything else, but I think if I want to latch on to anything that we all need is those relationships, especially as men.
Yeah.
Women have girls' nights all the time. They go out. Dudes, how long have you and I been saying, oh, we're going to hang out, right?
Yeah.
And then
we hang out like, yeah, that's how it is.
So it's interesting. It just happens that way.
So how do you push that person, or how do you push yourself Is it something that in a one moment that person, like let's say a client of yours or a patient of yours, that decides to go, is that a moment where they say, I'm done, enough, I'm gonna go get help? Or is that something where someone, like a friend, someone that's close to them says, hey, here's a place, I recommend it. How do you break that wall on some people?
I think it's just education more than anything. It might be somebody that refers them because he's venting to him, and so he's like, well, actually, I've been getting therapy, and I don't think I could help you anymore. The things that you're talking about, I think somebody needs to dig a little bit deeper to understand what it is exactly that you're going through and why you're responding or acting this way as a result. Or, hey, bro, this is out of my scope. Like, I can do a teeth cleaning, but you know, like if somebody comes to you with a deep, even to us, if somebody comes to A&P and let's say I mentioned it earlier, if they have an eating disorder or they have, or they just need a higher level of care, then I have people that I refer them to.
Got it.
Because you have to understand your scope and your limitations, not only as just friends. Like friends could come to me and they're like, oh, you're my therapist. I'm like, I'm absolutely not. Therapy goes much deeper. It's a lot more work, and I cannot know you because I'm going to have biases towards you.
Yeah.
Because you're going to ask me something, and the question I ask you in return might offend you, right? Because it might be about your spouse or about this, and then now you're going to get defensive towards me because I know your relationship. It doesn't work that way.
Yeah,
You need to be a neutral party.
Yeah.
It needs to be a neutral party for sure.
That's a fact there.
So you were mentioning before, like how a lot of people, like nowadays, like, you know, they go out all the time, and they're always like, that's like indices of like they're hiding something, and then they
Coping mechanism.
Yeah, coping mechanism. Can you touch a little bit more about that? Especially in Miami, it's a place where, you know, it's parties, alcohol, women, sex,
Drugs.
like everything.
Yeah. So it's an easy place to cope. It's an easy place to escape, and so that's what we do. Listen, think about it. Alcohol is an amazing tool. You guys are like, what is he saying? It is. It works. You get to drown all your problems. You forget about it. Your inhibitions are gone, and then all of a sudden, things are good for the short term.
Yeah.
Once it continues, then problems come. The DUI, feeling like crap, relationships that get severed because of what you say when you're under the influence, et cetera, et cetera, et cetera. So again, short term, sure, it works, it's effective, and I understand why people go to it. But it's the long term play where you have to realize it's destructive. And it's the same with all of those other vices that we talked about. They're all, if you think about it, they're all escapes. They're all just coping. We're all just trying to run away from the thing, from the feeling that we're experiencing. And if you are living your life day to day when you're alone, and these things are circling in your mind, and you just can't seem to organize them or get a grasp on them, then why not talk to somebody?
Yeah.
And what a lot of people tell me is, nobody knows me better than me. And I'm like, good for you. So then let somebody help you dig a little bit deeper. They don't know you, but they're going to help you dig a little bit more to understand even further. Treat it as an exercise.
Yeah.
Now, do you think that you're seeing, like, I don't know if it's a shift or an increase in, you know, there's more people like you that are getting on social media, raising awareness of mental health, saying like, yeah, this is normal. We can talk about this, that there shouldn't be the stigma. Are you seeing a drastic increase, I guess in men mostly, but overall in people that are more into looking into therapies and changing life habits and diet and exercise versus just come in, I want the prescription and I don't want to deal with this?
Yeah. I think you see it here in Miami. Actually, there's a huge movement of people who are opting out of alcohol, they're having,
Huge health community.
coffee and chill and all these different events that are going on in the community where you realize that, yeah, there is definitely a movement and a shift. I just don't want it to go too far where we think that these are all remedies for the basics.
Yeah.
Right? For just really sifting through what we're going through. Because again, those can become just escapes, right?
That becomes
that fitness event and that this and the high rocks and I did this, but it's like, okay, well, psychologically still, are you good?
Yeah.
Physically, it's great. You're doing those things to help yourself, but is everything else, are you checking in? And if you are, great. I mean, more power to you. And you're doing it in a healthy way. You're not doing it in a way that's going to be self-destructive in terms of drug use, alcohol use, et cetera. So do I see that there's a movement? Yeah. is the percentage of patients that come to my office still, I think, 80-20? Yes, 80% women, 20% men.
Got it.
Yeah.
And you mentioned before, which I thought it was really interesting, that that you don't. There's a lot of people that nowadays, when they seek therapy, they just get put on some medication and that's it. And you were talking about how you go beyond that and you try to touch other parts of the health, and the medication being just like a tool that, but you don't want your patients to be on can you touch a little bit more about that?
Listen, I think, again, medications are a great tool, but are we doing all those things that I mentioned earlier? Are we going through those pillars with the patient? Hey, let's talk about your sleep hygiene. How are you sleeping? How many hours you sleep? Let's rewind. Let's go a little bit further back. When's the last time you had blood work? Let's look at this from a biological level and say, is everything checked in? Then, so that's where it's like, these are steps, but everybody wants to jump to just the
Fix me now.
quick fix,
Yeah.
instant gratification.
Yep.
This is going to work. The Prozac can help alleviate symptoms of depression, anxiety, irritability, et cetera, et cetera. The SSRIs in general can help. The Prozac will not fix your marriage. The Prozac will not solve your trauma, right? It won't. It can help alleviate some of the symptoms, but it's a Band-Aid, and there's a root cause. You guys, when you do, I'm sure you guys look at root cause all the time, like what's causing whatever issue that you guys are looking at. It should be the same, but in healthcare in the United States, if you're using your insurance, oftentimes they don't cover some of those. That root cause analysis isn't covered sometimes, or at least to an extent, it's not covered, which I don't have a remedy for. Sometimes you just have to come out of pocket, and it's an investment to make.
Well, and at least dentally, you're talking about root cause. A lot of times if people come in and it's, wow, this is a full mouth, you got to fix everything. It's usually caused by severe clenching, severe grinding, when they're sleeping, because they're stressed.
Exactly.
And that's something that we see every single day. No matter what.
There's a direct correlation.
100%.
with mental health.
100%.
100%.
And it's always, are you stressed out? And they kind of give you that, like, yeah, of course,
Yeah.
who's not? But you're like, no, but your teeth are half gone.
Yeah.
You've ground 50% of your teeth away, you're 35. You know what I mean? Like, what's going on that's causing
And
this
what's
level of
incredible is that a
distress?
lot of them, to be honest, and at least in my world, are very high successful business owners because they're stressed. So I'm kind of going to dive into business. And
I'm
healthcare
stressed right now, guys. I'm stressed right now.
Yeah,
Everybody is.
business owners that when you're at the top of the totem pole in your company, you don't really want to have that conversation with Vince, because that shows weakness in the mind of the top of the totem pole business owner, right? So I find that a lot of the times when I'm having conversations with these CEOs that are super high net worth, man, it's almost like they relax, because I put myself with them and I talk to them like a friend, because a lot of them don't got friends. And that's that one pillar that you're talking about. They don't have that sense of, hey, I don't have the friends. I have people that want to be friends, but I don't have a real go-to.
Yeah, the circle gets smaller.
The
as you
circle
go
gets
up.
real small.
Yeah.
And it gets real lonely. I'll be honest. You were talking about the guy watching the Netflix, going to sleep, having no one to talk to. There was a period of time that was me. That was very sad. I now that I'm married and I have a great family, my life has changed dramatically, right? I was going through that, so that kind of hit me a little bit, because I remember that person sitting in my apartment down the street when I used to live right here. That was me.
That's hard.
And it's hard. But a lot of the times I see these people that have these businesses that manage so many people, but they can't manage themselves. So it's like, how do you, it's getting that outreach. But it's a tough question to ask, but how do you kind of broach that subject, or how do you talk to people, or how do you go about breaking those barriers when you don't have the know or the wherewithal to do that? Like, for example, it's tough for me to tell somebody, hey, bro, you're having a hard time. That whole mouth of yours, you may need some therapy. That's a hard one to tell patients, because it's a very
balance.
Oh, because they're going to get defensive right away.
defensive immediately.
Well, of course.
It's tough. It's a tough thing. So that's why when Oscar was like, oh, we're going to have you on, I was like, this is awesome, because this is a big correlation, because I find 99% of my patients, a lot of their problems stem from something deeper.
Maybe using just simple screening tools like a GAD-7 or a PHQ-9, which are just screening tools for anxiety and depression.
That's
and
cool.
that way it's objective, and they actually
Right in their medical history report.
yeah, exactly. And that's something that they do as they're checking in, and it's standardized. They do it in almost every primary office. So I think I would encourage you guys to absolutely have it.
Yeah, we have our friend Jose Aquino, the plastic
does
surgeon. He does that.
Yeah.
You won't
Part
treat
of-
them unless they go through.
They have to go through a
screening.
psychiatrist, speak with them before he does the treatment. I think that's excellent. Even though, like, he was telling me, it's like at first, like, he delayed treatment, like, you know, you want to make money, you want to do the procedures. But then at the end of it, it's like, when I started implementing this, I was getting better results long term. I mean, at first it affected me because you had to change your routine of things. But, you know, somebody that's go through a big procedure, like our procedure, same as plastic surgery, like, these people are spending a great amount of money to fix their whole mouth, but we haven't even thought about, like, are they ready for this at this moment? Like, it's my work going to be followed by what they're going to do after. So in his case, he's like, I'm doing all these beautiful bodies, but then you're still, if you're not going to diet, if you're not going to exercise, if you're not, then I'm not going to be successful. And then you're going to look at me and say, like, oh, you did it.
Or they might have body
job.
dysmorphia, and then it's never going to be good enough.
Well, I'm glad you guys are talking about this because that's the standard in bariatric surgery. If people are going to have a gastric sleeve or a gastric bypass, they have to go through psych counseling, nutrition, psychiatric clearance, sometimes therapy and counseling, nutritional counseling, and they try to get them to do some sort of lifestyle change beforehand, because otherwise it's the same thing. You're going straight for the quick fix, and there's nothing that happens beforehand because the lifestyle change never happens. And guess what? These people have bariatric surgery, they have the gastric sleeve, they have gastric bypass, and 5 years down the road, 7 years down the road, they are even bigger than they were before.
Yep.
So I think it's good that you guys are even thinking about this because it will long-term help you more because you're probably going to have better patient satisfaction down the road.
Right.
Because you're going to have that conversation to say, hey, I think there's some other things to address here and I'm not the professional to do it, but I can definitely link you to somebody who can.
Well, I think there's also not even just in the initial phase of treatment where you do a full mouth rehab, it looks great, patient's happy. Then you'll have something where, 5 years down the line, they've never had an issue. Now they're breaking teeth and chipping teeth, or they're getting tons and tons of cavities that they never had before, which we see a lot if someone has heavy drug use, teeth fall apart, heavy grinding, veneers and everything break. And I think it's interesting that, you can see someone's life change and everybody gets stress, and that's just part of life. But if you address that mental health side or the readiness of the procedure at the time, when those things start to happen, I think it kind of open up that conversation like, hey, has something changed in the background of your life that now we're seeing the ramifications of it in your mouth?
Yep.
Where you're not sleeping, you're doing drugs, you're stressed and grinding, whatever the case may be, your marriage ended, something that's causing psychological distress.
And it's usually something like, like you were talking about, like we have patients all the time that I have my own patients that have been like, everything's been fine. And now, like, you start, like Ben said, seeing all these changes in their mouth. And I asked them, like, what's going on? If there's anything, like, what's going on in your life? What do you mean? I'm like, yeah, like, is there, why you seem to be stressed? Like, what is there? And then most of the time they're going to tell you, like, oh, my husband passed away, and then you start seeing from that change in their life. Now it reflects in every single aspect of their life, like
not
in
just
their oral health, in their weight, everything, in their physical health, their mental health, the way they take care of themselves, the way they, and so I and one of the good things that you have, for example, for me, like, I'm busy all the time. Like, I work every day till 5, 6, till whenever. And then I'm always, like, in the mentality of working. So for me, one of the big obstacles was like, well, like, I don't have the freaking time to go somewhere and sit an hour, not just the hour there, but the hour to get there, to leave and all that. So you guys offer telehealth, right? I did everything through a Zoom call. So I had my schedule every Friday at 4 p.m. where I had my conversation with my therapist. And I think that's great because there's more tools. So for those that are listening, like, if you're struggling, like, reach out because there are solutions. Like, you don't have to go there in person. Maybe you can start doing something via Zoom. Like, nowadays, like, we use technology to our advantage.
Mm-hmm. Yeah, and a lot of people want to say, oh no, but I want to see this person. I want to see somebody in person, which I respect 100%. But if you don't have that availability, now you're creating another barrier for yourself for getting help. So if you just, like you said, if you just put it into your schedule and you don't have to go anywhere, go lock yourself in a bathroom. It doesn't matter.
Easy.
You have the access. And again, bro, I'm not trying to sell you to my practice. I will recommend, look, there's Live Well Therapy. What else? Let me start recommending a bunch of other companies because I really don't care about people coming to my office. I will get patients. And there's so many of us, there's enough for everybody to receive patients and to get help. Yeah. And it's just a matter of how do we get people to take that step? And listen, if you don't really relate to that first therapist, it's okay. Treat it like Bumble, but give it a couple more dates. Right? Give it like 4 or 5 dates, and you say, "Oh, I didn't really vibe with this person. Maybe culturally there was a disconnect. They didn't understand." You're first generation Cuban, right?
Yep.
So you come and see me. I already know what was going on with chancletas flying in the house. Mom would scream, "Me tienes hasta el último pelo," right? He's from Manhattan. You said from Manhattan,
Pennsylvania.
Oh, from PA. PA. I can't relate to the culture as much, but I mean, but you live in Miami. You've been living here how long? A year and a half. I mean, I'll get to know you and I'll see where we relate and I'll see where the rapport is. But and you might say, oh, I might jive a little bit better with somebody who grew up in Connecticut or New York or from the Northeast because maybe culturally you relate to them more or they understand you. That's perfectly fine. But don't just shut the door on the therapist on the first day and say, oh, this guy sucks. Yeah. This guy sucks.
Yeah, you have to be able to like give it.
It's not a one-off. It's not a race. Like this is a process. So you have to go through it. You know, their first therapy is just to kind of get to know each other, where you're just talking about yourself, and then as you open up, they start to kind of seeing where your deficits are, and then in future consults, that's where they start diving in. I mean, I'm the type of person, I like to study everything in the sense that I'm like, when I'm doing therapy with somebody, like I'm thinking in the back of my head, all right, I said this, now they're gonna say this thing. Like, it's like, like.
And then they ask you something you weren't expecting. You're like, hey, you weren't supposed to ask me that. That's not where we're going.
No, but I think the assessment that he says to put into our medical histories for any of our other practitioners out there listening is incredible because, you never know what someone's going through, and ultimately you don't want to get them to a place of no return. And I speak from someone that unfortunately had the experience of when I owned my first office up in Kendall on 167, in the parking lot, some guy took his own life in the parking lot. And I remember getting to work and I see a bunch of cop cars that day in the morning, and this gentleman literally took his life in the parking lot of that shopping center. And I go, what led to that point of no return for this guy? Because that's ultimately sad. You're sitting in this car by yourself having that situation. And it's not the first. I knew a classmate of mine when I was in college that did the same. And he was our age. And it's like, you think about these things and I was like, why didn't they have someone to talk to, or did they not want to talk to anybody? Why wasn't that outlet? So I feel like when I see these things, especially with my friends, I'm always the one to say, hey, bro, how you doing today? Yeah. Because sometimes it takes that moment. But unfortunately, a lot of people either, one, don't care. Let's be real. A lot of people don't care. Yeah. Or number two,
or they don't know how to have that conversation. They don't know how to have that.
Exactly. That's where I was going. Yeah. Or they don't know how to have that conversation. They don't want to be awkward. Mm-hmm. There's a lot of times where it's like they don't want to have what I call a sweaty back conversation, but sometimes you got to have it. Yep. Even in business, you're having an employee that's having an issue. Deep dive into that and see what's happening. Have that sweaty back conversation, because that could spiral into something worse.
No, right? I love that you're saying that, because that exists in every facet of our lives.
100%.
Hard conversations are where growth happens. Mm-hmm. Whether it's with a friendship where somebody kind of disrespects you and you have to address it and set a boundary, or maybe it's in your relationship where it's like something that is just, it's in the air and you just have to put it out there. And it is literally a sweaty back conversation where you have to just say, this is what my mindset is, or this is how I interpreted the way that you acted or behaved towards me, and I just want to put this on the table so we could address it now. If you don't address it, then it grows and festers and grows and causes resentment. So
yeah, because I just find that most people just don't want to be vulnerable, and they don't want to open that door.
I'm learning now. I'm going to be 42 this year, and as a boss, I'm just learning how to have those hard conversations and just again, objective. Just address it on the spot. Mm-hmm. I'm not even letting it linger. I'm not processing it for a day or two. Hey, let's talk about this right now.
Right then and there.
Yeah, I want to nip it in the bud.
It'll be way worse.
Yeah.
Yep. Because so-and-so will tell Fulanito will say something about so-and-so and so-and-so, and then things start, and the forest fire happens when you could have controlled it, and a lot of the times they don't want to talk to each other. Like, let's say you have two employees that are arguing with each other. So normally I'll say, hey, do you need me to mediate this conversation? Because you two need to figure this out.
And that's the way to do it. I remember when I was in the military, they had, people sometimes will fight and stuff like that. And then when you fought somebody, what they did was, let's say like we got into a fight. So the sergeants will grab our hands and literally tape them together. And then for the next week, everywhere we went, we had to be holding hands. It was the most hilarious shit ever. Like you will see guys out fought in the at night, like whatever, and then the next day they're like holding hands.
Did it work?
It works.
It works, right?
It works.
After all, you're like, hey, we're here. We're in this together.
We're together. Like that's just how it is. But so Adrian, you're very active on social media, so we're going to be putting your handle and stuff so that people can find you. But I will say to dentists and everybody that's listening, whether you're a business owner or just personal going through something, like I will recommend to reach out. Like you mentioned, like it doesn't necessarily need to be with you, but at least you can guide them. For those dentists that want to implement this into their practice and maybe dive a little, just have that form, dive a little bit deeper just so that you get a clearer understanding of what that patient might be going through. That's something that, will also help the success of treatment in general. So, we can start implementing that ourselves too.
I just think it's a good resource to have, whether it's for a patient or, like you just said, like if you're a business owner and you have a full team, like something happens, you're like, no, we got to get this dealt with. Don't let it spread. Don't let it become an office thing. And just having one resource that can lead to many others is very important.
100%.
I'm the guy. I promise you.
Especially helping things. So like there's a barrier that I like to call, and you probably know a lot about this, growth versus fixed mindsets, right? So a lot of people are stuck in this fixed mindset where they're constantly calculating things that put them behind. They don't think they're good enough. They don't think they can. They don't think they could reach the top of the mountain. They don't have somebody to talk to that get them snap them out of that situation to put them in a growth mindset. You, for example, the fitness, the diet, trying to be great at what you do. You're always trying to excel. You're always thinking that you're going to grow. Whereas others, and I've been there, don't think they can. So then they're not excelling in their life. So finding a source and outlet like AMP Health that really will help break barriers down to help everyone grow, not only in their business, but also in their personal lives. Because ultimately it all stems down to the person that you said, point to yourself.
No, it's always
right?
you. Once
It's all
you change
internal.
that internal obstacle in your life, you're going to realize how much further you're going to excel. For me, it was like that. Like, everything that I've ever gone through, every time that I've been stuck in something, it's always been me. It's never been anybody else. And once I reach for the help, or once I've overcome that, then I noticed that I've grown and that I have succeeded. And yeah, I think it's...
Well, and that's like a muscle. Like,
yeah, it is.
Like
Mine is just like a muscle.
For me, that started in sports growing up. You're always like, I want to be the best. I want to be as good as I can be for a team, especially a team sport. Like, you don't want to let your team down. That's like your family outside of your family. And once you're in the habit of, okay, we did this today, how can we get better at the next thing? That was like the baseline for me. It was sports growing up. And then it was in school. How can you excel in school? What do you have to do to get better? And then professionally, it's like, we now sit down. We take a picture of the temporaries. Yeah, what do you see? What do you think can be better? And it's always like, grow, get better. How can we refine this? And that's, once you get into that habit, you don't have to think about it. It just goes.
And as you were asking for feedback, does Oscar turn to you and say, "Oh, this is a shit job"? No,
Never.
right?
No.
It's always objective feedback.
This looks great. What do you think if you make this tweak or this change? And then it's like, oh yeah, I do see that. Or it's, well, what do you think if I do this? And then it becomes a collaborative conversation of what we're both seeing and training our eyes to be better so that our hands can make the changes that we
And the reason I said that is because it's the same. Both of you guys are going to be fathers soon, and it's the same for anybody who's listening that's a parent. I have a 16-year-old, and then I have one on the way. So,
Congratulations.
oh, thanks, man. I appreciate it, bro.
Congratulations.
all three of you guys.
Yeah, it's wild.
Your next.
But as your child grows up, right, you could either just be critical, right? And a lot of our parents did this to us. They came, came from as immigrants. They didn't know anything, and they were just like
Very
grinding.
critical.
They were in survival mode, very critical and controlling. Why? Because they didn't have control themselves. So it's really easy to push that onto your kids. So keep that same mindset. Look for objective feedback. Allow them to try and fail, and then circle back around, readdress, and attack again. And it's the same thing. The same way you were describing that is the same way with your kids. It's the same way with people around you as you're leading them. You shouldn't be critical and bashing people. You should identify weaknesses, again, objectively, so that you could address it. How they receive that might be different from person to person, and how you deliver that message is going to be different from person to person. But it's extremely helpful. It's extremely important as you lead to think about, how do I address these weaknesses without crushing this person's ego?
Correct.
So,
And that's something that, we do it all, like you mentioned, we do it all the time. And you,
I'm a
you did it
coach.
with
I
me
coach it.
back
I
in the day.
coached him, and I love it.
He was a little bit too, hey, what do you think about this? Looks like shit. But I can take it.
I knew you
but then it will be like, all right, so this is how you fix it.
Yeah.
Yes.
But yes, we do at work the same thing. Every time that, and whether it comes to like work that we're doing at the moment, or just like in personal in general, like how do we get more patients? That's one of the biggest things that, that we struggle with. It's always the
hardest thing
It's the hardest thing in dentistry is
business.
getting patients, and hardest thing in business it's getting
phone
the
to
patients
ring.
to
Of
come in.
course.
Exactly.
Yeah.
So like having that mindset of like helping the other person out, I believe that if you put good out there, you're gonna receive the same thing
100%.
back.
Yep.
And yeah.
So where do you see AMP going, brother? What's the next steps for you?
Yeah, it's a great question. So let me just rewind. Let me tell you about how we got here.
Yeah, absolutely.
So, I was a full-time professor at the University of Miami. We're mid-COVID, June 1st, which is almost exactly 5 years from a week from now. I get a Zoom invite, and it's the dean of the school and my immediate supervisor. And I'm thinking, we're going to go over what I'm teaching next semester. P.S. I wasn't really happy as a professor. It wasn't everything that I thought it would be. UM is very prestigious. It was a great platform for me. It definitely helped me. But on that call, I was read from a script, and 14 other people got read from that script. And that script said, as of June 1st, 2020, your contract with the University of Miami is being terminated.
Wow.
Effective today.
Wow.
Mid-COVID, full isolation. And I'm just like, I remember leaning into the Zoom screen. Guys, today is June 1st. They must have been like backing up. And I'll never forget that day because we all run into these walls in our lives, and they will either make us crumble, or you will rise, you'll become resilient, and you'll find a way out. And I have framed that termination letter. When I started AMP, it was kind of a side project at that time, maybe seeing 4 patients a week. We're now seeing 16,000 patient visits a year.
That's incredible.
We're a team of 32. It's been a hell of a ride. It's been a major blessing. I've grown a lot as an individual. And I've been able to help so many people, which is probably the coolest part. And I always knew from the beginning I couldn't do it myself. And so I always had that team mindset. I need to build a team. And so where are we going? I just purchased a building, small building, on Coral Way and 24th Ave, which is under construction. I am currently working as a project manager.
It's all good. That's an incredible pivot story.
Yeah, it's been a hell of a ride. I mean, in my past, I worked at Camilla's House with the homeless. I was also in the military, like Oscar. And so, I mean, you go through all these little parts of your life, and now we find ourselves as middle-aged men. And
So what's the plan for the building?
yeah, the plan for the building, basically downstairs, is it's gonna be multiple suites. And I already have my buddy who's a neurophysical therapist. He works with post-stroke patients. It's called Gateway Therapy. I just partnered with him, and so we're gonna try to grow a very specialized physical therapy practice. That's just one part of it, and then the rest we're gonna have some in-house therapy, but then we're gonna have an opportunity for new clinicians that are coming up that need an office space, whether it's speech pathology, ABA, PT, OT, maybe an esthetician. I just want to give opportunities to people, and right now that's what I'm looking to do. I'm looking to inspire new medical professionals who might be stuck in the system, the major health systems that want a way out, who don't have a roadmap for entrepreneurship. And I want to give them that. And I want to show them, do you want to go the self-pay route? Do you want to go the insurance-based route? And just kind of give them that roadmap, because I know that if I found that opportunity and nobody gave me the roadmap, and I want to give that opportunity to other people.
That's awesome, man.
Because I've never seen a mentor. I'm yet to meet a mentor who's doing anything like that, at least not in Miami.
That's incredible.
Yeah. So I'm
awesome,
excited about
Man.
that.
Awesome, brother.
Thanks, bro. I appreciate it.
So can you tell our audience how they could reach out to you, where they can find you on social,
Yeah,
so that they
absolutely.
could reach out to you?
Yeah. So my practice is at AMP Mental Health. So it's Alpha Mike Papa Mental Health. And then mine is at Dr. Adrian Mesa. And you can call me directly. My cell phone number is 786-255-1158. My office number is 305-204-9355. We accept every major insurance company. We're available throughout the state via telehealth down here in Miami in office.
I think this is an incredible podcast. Open up the minds and the hearts of everyone listening. If you need help or need any counseling or just going through a tough time, don't be alone. Contact Adrian, contact his people. And then this is an incredible podcast for me personally. So
Love it.
thank you for coming.
No, thank you
you
guys.
for
It's been an
sharing
honor,
your
man.
vision. We're excited to see this building when it's done, because it's going to change lives. So I appreciate you. And, thank you for joining us on another episode of Dental Talk 360. We appreciate all of you. This is Dr. Alfredo Arauz
Dr. Oscar.
Dr. Vince.
and Adrian, brother.
Thanks.
Hey, man, thank you for
All
coming.
right.
Thanks, guys. Appreciate it, man.
Yeah, man. You're welcome.
All right. Thank you, guys.
Good stuff, man.
Yeah, man. That was awesome.